The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health and Wellness. Ambulance offload times at our regional hospitals are rising. In fact, not one of our regional hospitals met the offload standard of 20 minutes 90% of the time this year. At times, paramedics are backed up for hours waiting to transfer patients into the care of the hospital. Mr. Speaker, can the minister tell us when regional hospitals will be meeting these provincial standards?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. Indeed, work is and has been ongoing to investigate and identify means to improve the offload process, Mr. Speaker, to improve the ambulance offload times and address this very concern. I've mentioned to the members here, Mr. Speaker, in the past the successful work that's been done at Dartmouth General to improve these offload times. Despite an increase of about 22% in emergency visits by ambulances at that site, they actually maintained or possibly even slightly improved their offload performance over the last year based upon those changes.
The honourable member for Cape Breton Centre.
Mr. Speaker, in its last evaluation of the Nova Scotia Health Authority, Accreditation Canada noted that serious issues with patient flow, including the presence of alternate level of care patients in hospital beds, were contributing to emergency department bottlenecks. In a news article today, an NSHA staff person confirms that this issue is a direct result of the high number of people waiting in hospital beds for long-term care placements, and I'll table that. Mr. Speaker, can the minister confirm that he will open new long-term care beds to address this problem?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Indeed, it's recognized that this is a complex problem. We see the effects through the emergency departments and with these offload times for the paramedics that are looking to have their patients transitioned directly into the hospital. Mr. Speaker, our hospital and healthcare system is an integrated system, and each part depends on the others. What I can tell the members is that over the past number of years, we've reduced the number of people waiting in the hospital for long-term care. We've reduced the amount of time those people who are waiting in the hospital for long-term care are waiting. And Mr. Speaker, we've already announced that we're going to be adding additional long-term care beds in the Cape Breton region.